going to discuss the nose and the paranasal sinuses. We learned a little bit of development of this paranasal sinus and the clinical things as well, which is related to it. But largely we are going to talk about the gross anatomy of it for the day, and we are going to talk about the clinical important regions, which is important for us for examinations and our clinical life as well. Now, the questions of this particular nose and the paranasal sinuses are principally coming from these particular different types of paranasal sinuses, and where do these particular paranasal sinuses have opening into, and as well as these morphological features of this particular nose or the nasal septum. The clinical problem follows through these particular problems. So, this part we are familiar with about the nose. The functions of the nose is having a dual origin, is an organ of olfactions, which is a special organ for us for smell as well as taste sensation, equally contributed by these particular mucosas on this particular nasal cavity, as well as is contributed as an element for the respiratory system, so that as we are breathing in and breathing out, it is a part of respiratory system. Now, the respiratory system is divided into two parts, upper respiratory, lower respiratory. This is included in the upper respiratory system. Now, this particular nose have got olfaction function, respiration. It also dehumidifies or humidifies the air, de-dust this particular air if it is having a lot of dust particles present to it, and as well it also present as a source for exit of the tear. So, all the tears that is shedded from this tear gland is eventually channeled through the duct which opens into the nasal cavity. So, the tear drains through this nose or nasal cavity. So, coming to this particular morphological structures of the nose, it can be divided into two basic parts, external nose and internal nose. So, that part which you are seeing externally, we call them as external nose, which is composed of the skin which is covering to it. Deep to that we have the skeleton structures, partly is made of cartilages, partly made of bones. So, these are two elements which is present. The anterior part is cartilages, which has got the different shapes individual to individual, and the deep part we call them as made of bone or osseous part of this particular nose. Now, if we have a trauma to the nose, this bony part fractures, because cartilage being a flexible structure escapes the fracture. So, this nose externally can be made or divided into two parts, upper part which is the bony part, lower part which is the cartilaginous part. Now, the skeletal contributions to this part, apart from this particular septal cartilages and as well as this particular nasal cartilage and alar cartilage, is made of this nasal bone, is contributed by this frontal bone nasal process and the maxilla frontal process. These are the thing which is contributed externally, the bony framework. Apart from that, we have lots of cartilages which is forming the lower part of this nasal skeleton. Coming to this important for us segment, we call them as nasal septum. The partition between this nasal cavity is split into two halves, right half and left half. It's also partly made by cartilage, partly made by the bones. Now, this posterior part above and below, we have two pieces of bones there, and anterior or anterior inferiorly we have cartilage. This shadow in this blue is cartilage, and the posteriorly you are seeing these two plates are there. Above we call them as perpendicular plate of ethmoid, which is basically continuous with this anterior cranial fossa above, and below we have this small singular piece of bone in the pink shadow which is present, we call them as vomer. So, this vomer starts with V and this perpendicular plate of ethmoid bone, they are forming this particular posterior superior half and inferior half, and you can see that posterior to this particular part we have this sphenoid bone and this sphenoidal air sinus lying deep to it. Anteriorly we have this septal cartilage, this part of this septum we are contributing or talking about. Now, the septum is splitting this particular nasal cavity. The nasal cavity have got two openings, one external, one internal. This opening we call them as internal nasal opening. The external nasal opening is visible to us. Internal nasal opening or inner side opening of the nose, clinically also known as Choanae. which is clinically sometimes they use the word choana. So this is what you are seeing here is the lateral wall of the nose where no septum is there. This is the picture which you are seeing here, septum into it, and the two openings are there. This is external, the red one, external nasal opening. Here is the external nasal opening for us. Now, this is the nasal septum, and here we have an opening which is opening into the part of the pharynx. We call them as nasopharynx. So here we have an opening there. We call them as posterior opening of the, which is opening in the nasopharynx. We call them as choana or choanae. This word you have to remember because sometimes they use this word choana, which can be occupied by a growing lymphoid tissue. We call them as adenoid, which is a part of the tumor or part of this lymphoid tumor which is growing from the nasopharynx and blocking this choanae. Clinically, that part is probably covered in a nasopharynx. Moving from this nasal cavity, the different areas of the nose or nasal cavity. It has a roof, it has a floor, it has a medial wall from the medial septum, and has a lateral wall. Lateral wall is having this particular shelf-like structures. We call them as conchas. Three pieces of them: superior concha, middle concha, inferior concha. In between the space between them, which is carpeted by this mucus, we call them as meatus. Now, coming to this superior part, roof. Roof is formed by this frontal bone and posteriorly by the sphenoidal bone. Floor is formed by this hard palate, which is palatine bone and a maxilla. Medial one by this medial wall septum that we have just discussed about here, Vomer, perpendicular plate of ethmoid and the septal cartilage, which is making this medial wall of it. Lateral wall by these conchas. So this is the cavity of the nose which has boundary to it. We have to know a little bit about. Basically, very easy question, sometimes been discussed or asked in the questions about state or differentiate the different boundaries of the nasal cavity and the contributing bones or the cartilages to it, and the opening related to it, external and internal. In between, we have this nasal cavity. Now, coming to this particular lateral wall that we are commonly faced in examination. The lateral wall also, we have seen that in bones and as well as in the sections, like we call them as like sagittal sections of the brain along with that. So, this particular piece of the bones that you are seeing in the bony skeleton, we call them as conchas. So, superior concha, middle concha, inferior concha, they are piece of bone present on the lateral wall of the nose. Lateral wall of the nose itself can come as a short note with the descriptions. In between this particular conchas, this superior concha, middle concha and inferior concha, we have a layer of epithelium or carpeted by this, as I am saying, the rest epithelium, which is likewise the epithelium of respiratory epithelium. So, this particular conchas are covered by this particular epithelium. The spaces between them, we call them as meatus. So, in examination, they specifically ask about what do you mean by the conchas, what do you mean the meatus. So, you have to define in one word. What is concha, what is meatus, and how many of them are there, like superior, middle, inferior, and meatus likewise, how many of them are there. So, you have to know the names of this particular meatus or this particular conchas. So, they start with this meatus, we call them as supreme meatus, superior meatus, middle meatus, inferior meatus. Supreme meatus also known as sphenoethmoidal recess. In ENT division, they do not use this particular sphenoethmoidal recess many a times. They use this supreme meatus word. So, supreme meatus or sphenoethmoidal recess are the same. So, that is a space which is lying above the superior meatus. This particular space which is lying superior or posterior superior to this superior concha. So, we identify these 1, 2 and 3, go to the top of them, and this particular space between this sphenoid bone and the superior meatus, we have this particular space, we call them as sphenoethmoidal recess. What is the importance to it? Into this particular space, opening of this sphenoidal air sinus is ejected in it. So, it has an opening which is received into this particular space, we call them as sphenoethmoidal sinus or sphenoidal sinus, which opens into it. So, each of the space you have to know, and what opens into it, that is what you have to know, which is put on a star mark on it is your exam question. How can it be tested as well? In the radiology section as well. We may point this particular meatus in the sagittal section, x-rays, and mark it what opens into the sinuses. Next is superior meatus, which is the space lying between the superior concha and the middle concha. In this particular meatus, which is a space lying in it, opening of these air cells, we call them as posterior ethmoidal air cells, individually or separately opens into this particular space, having may have multiple opening or may have a single opening depending on individuals to it. Coming to the important meatus, we call them as middle nasal meatus. This middle meatus, you have to know where this particular meatus is, between the middle concha and the inferior concha, that particular space wide enough. This particular middle meatus have got parts. It has a slit or semilunar slit. We call them as hyalunar. We call them a semilunar hiatus or a hiatus semilunaris. So this particular slit is there, which has got anterior part, middle part and the posterior part. So anterior part of this particular hiatus semilunaris or semilunar hiatus has an opening of this frontal air sinus and anterior ethmoidal group of air sinus. Then middle part, which is having the slit in it, opening of the maxillary sinus and middle ethmoidal sinus. Posterior to it, we have this particular bunch which is elevated over here. It is created by this middle ethmoidal cells. This thing is clinically important. This middle ethmoidal cells creates a bump here. We call them as bulla. We call them as B-U-L-L-A. This bulla, whenever they are going for endoscopic surgery, the ENT surgeons notes this one. This is the point, they identify this bump and under to that they tuck in to get through this particular sinus to do endoscopic surgery to the sinus spaces. So this middle meatus have got number of opening which is coming in it, and you have to know in sequence or randomly what are the different openings there. So this is a mostly a highly tested region in amongst this meatus is there. Middle meatus, define it, define this hiatus semilunaris or semilunar hiatus, what opens into this or what paranasal sinus opening is linked to it. Inferior meatus or inferior nasal meatus, that's particular space which is lying under this inferior concha. So inferior concha, inferior to it, we have an opening of nasolacrimal duct. So this nasolacrimal duct, what do? They carry the tear secretion. They are secreted from the lacrimal gland. This lacrimal gland secretions coming into this particular lacrimal duct through the punctus, and this particular puncta opening drains into the inferior part of the nasal concha. We call them as nasolacrimal duct. So this particular nasolacrimal duct basically carrying the tear from the eye into the nose and drain through it. So in short or in detail, you have to know all these particular domains of these particular conchas and what do they open into it. So superior concha, superior meatus, middle meatus, inferior meatus, and what do they open into it? What opening or sinus opening or nasolacrimal duct, where do they open into these particular spaces? Coming to the blood supply to it, this is clinically important. So nose is supplied with tons of blood supply, it's highly vascular. 3 different source artery feeds this particular nose and the middle part of the nose. 3 source of artery, we have the maxillary artery, facial artery, which are supplying to it. Along with that, we have arteries coming from the eye or orbit, we call them as ophthalmic artery. Ophthalmic artery splits into 2 branches, we call them as anterior and posterior ethmoidal arteries. Maxillary artery gives 2 branches which is related to the palate, greater palatine and sphenopalatine. They comes from the back side and the inferior side. And facial artery comes from the front side, labial or superior labial or lateral nasal branches. All these branches, they supply this particular nose region from this particular nasal cavity side and as well as septal side. Now all these artery branches, they merges in the nasal septum in the anterior inferior portion. This anterior inferior portions which is highlighted over here, which is related to the nasal septum, which is lying in or formed by the cartilage part, where we have anastomosis of the branches of all 6 arteries. This point we call them as Kiesselbach area, also known as Little's area. There are 2 physicists that are there. One is German, one is American. American one, which is Mr. Little or Dr. Little, and Kiesselbach, which is German physicist or German physician, who also narrated this part. To honor them, we equally give this credit to this particular point. Kiesselbach area, also known as Little's area of the nose. What's the importance to it? The importance of it, we have 6 different branch of artery coming here, making a conglomeration. That means union over there. We call them as anastomosis, where anterior-inferior wall of the nasal septum. Now, this anterior-inferior wall of the nasal septum having this particular point is prone to have ulceration or rupture. If it is ruptured, blood comes out through the nose, front or anterior nasal opening and as well as posterior nasal opening. That phenomenon we call them as epistaxis. We will come to it later on. So, Kiesselbach area, and remember these particular branches of the 3 different arteries sending 6 branches into it, forming an anastomosis at the anterior-inferior portions of the nasal septum. Last supply exam, they had this particular question. Little area, clinical importance to it, what artery coming in here, what is the importance to this little area in terms of epistaxis. Now, coming from there, outside of the nose, supplied by this particular 2 source artery, facial artery and as well as ophthalmic artery, dorsal nasal arteries or dorsal nasal branches. They are supplying the externally, but out of that, this particular arteries which is supplying this particular nasal septum is more important than that of external branches. What is important for us to this particular external nasal supply is the venous drainage. The venous drainage from the external area of the nose falls into the danger area of the face. Now, what is the importance of this particular danger area of the face? This particular veins which corresponds to this particular dorsal nasal vein or also known as facial vein, they have a deep channel connections. Deep channel connections to this particular deep facial vein. Deep facial vein to the ophthalmic vein. To the ophthalmic vein to the cavernous sinus. That falls into that particular danger area domain. Why it is important? They don't have valves in it. So, if you have infection in the nose region, in this particular danger area of the face region, infections non-guarded, non-taken care of can travel to the deep veins, from the deep veins to this particular cavernous sinus, to the brain, to the meningitis, to the encephalitis, to the coma. So, that is why this particular venous drainage from the external part of the nose is very important, whereas the arterial supply to the septum is more important because of the rupture of the vessels, epistaxis and cavernous sinus thrombosis. So, this is 2 contrasting things that you have to keep in mind related to the blood supply, venous drainage to the nose area, danger area and little area. Coming to the nerve supply. So, this nasal or nasal cavity is divided by or supplied by 2 nerves. Anteriorly, it is supplied by the V1 division of the trigeminal. Posteriorly, it is supplied by the V2 of the trigeminal nerve. That means ophthalmic division and maxillary divisions of this nerve which is supplying. This anterior part of the nose or nasal cavity is supplied by the V1. Posterior part by V2. V1 means ophthalmic divisions of the trigeminal, maxillary divisions of the trigeminal which is supplying to it. In easy words, you can remember this particular thing. Coming to this particular other nerve related to the nose. This is important for us clinically. Ophthalmic nerves, that means the special sense, olfactions, taste sensation, which are carried through these particular nerves. Where do these nerves live? High up. High up where? In the nasal cavity. Where high up? In the roof. So, the roof region of this nasal cavity, which is formed by this particular frontal bone and the sphenoid bone, this region is crowded by this particular mucosa. We call them as olfactory mucosa. They are non-vascular, not the vascular. They look like pill. So, this region have got this particular nerve endings or olfactory nerve endings. So, olfactory nerve endings present in the roof region come over here. They pierce the cribriform plate of the ethmoid and carry the sensation to this brain region, carrying this particular nasal the smell sensation from the nose region. Coming to the lymphatic drainage here. So, lymphatic drainage from this vestibule of the nose. What do you mean by vestibule of nose? The skin line part of the external nasal opening. So, that part of the skin line part of the external nasal opening, we call them as vestibule. So, this vestibule region of the nose or external nasal opening drains the lymphatic to the submandibular group. That means under the mandible, below the mandible group. Rest of these lymphatics from the nasal cavity all throughout this nose drains to the deep cervical group. directly draining to the deep region, tip of the nose, root, then root of the nose, the body of the nose, the dorsum of the nose, everything except one, the skin line part of the external nasal opening, which is also known as vestibule of nose. Sometimes they give the clinical question by nose piercing. We have a kind of like cosmetic reason to pierce the nose. We call them as nose piercing for putting some kind of ornaments into it. So the nose piercing principally involves in the vestibular area. If this nose piercing goes wrong, infected, that particular lymph node which commonly gets this drainage from that, which is submandibular groove, and again that falls in the danger area. So likewise the clinical question can be framed. Coming to the chapter for us is paranasal sinuses. So we learned about these particular expansions of the nasal cavity which are known as paranasal sinus. What do you mean by the paranasal sinus? We have the nasal cavity right and left. From this nasal cavity, it is fanning out to the neighbor bones. That's why they are known as para and para to the nose, and they are kind of expansions. That's why we call them as paranasal sinuses. They are going through different bones region, grow there. How they are present? These particular sinuses, they are lined by the epithelium. What epithelium? This same nasal epithelium, also known as respiratory epithelium. So this nasal epithelium can be divided basically into two broad parts, respiratory epithelium and non-respiratory epithelium. Non-respiratory epithelium means the olfactory epithelium, that part which has got olfaction, which is related to the roof of the nose. Rest of the respiratory epithelium are the same. So these particular expansions of the nasal cavity, you can see that this is the nose, these are the nasal cavity. And through this nasal cavity, two nearby bones, we have the expansions of the nasal cavity growing in different directions. Frontal bone expansion, frontal sinus. Maxillary bone expansions, maxillary sinus. What do they do? They have a channel connections to the opening into nasal cavity, where they open into different sinuses that we have talked over here. To the sphenoid bone, to this particular ethmoid bone, they are growing into different bones. Eventually, they drain to the same nasal cavity through the meatus. So this is what we are taking care for the class. So if this nasal expansion or cavity expansion grows into the frontal bone, we call them as frontal sinus or frontal paranasal sinus. So this paranasal sinus grow into this frontal bone. This particular frontal bone have got outer table, inner table. In between them, it grows over here. Where this particular sinus is there? In front here. You can see this. So this particular area of this frontal bone is porous and occupies the sinus over here. We call them as frontal sinus. This frontal sinus is rooted in here, grows gradually after birth. By first decade of life, we should have right and left frontal sinus. We call them as pneumatization of bones. So the bone which was solid, then it is hollowed or poured by this developing sinus which contains air, which comes through the nose and these regions. So this particular frontal sinus which is present in here has a communication with the nasal sinus, to the nasal cavity through this particular meatus, and it opens into this particular middle nasal meatus before or at the point of anterior to the hiatus semilunaris. So this particular frontal sinus which is present in here, if it is affected, if it is inflamed, the nerve supply to this region is coming from V1 branch. That means ophthalmic branch is picking up this or supplying this particular mucus over there. So if you have inflammations to this nasal sinus to the frontal bones or frontal sinusitis, the V1 or olfactory nerve, ophthalmic nerve of the trigeminal division should be carrying this pain sensation. The patient will be complaining pain in the forehead region because that's a region for the nerve supply to this particular V1 division of the trigeminal nerve. So this is how this nasal sinus, frontal sinus matters to us. Coming to the other sinus, we call them as ethmoidal sinus. They are basically bunch of grape-like looking structures. So small grape-looking structures which is present, looks like a grape, and they are invading or hollowing a bone. We call them as ethmoid. There are three different directions of these sinuses are there. We call them as anterior, middle and posterior ethmoidal sinuses. They open differently in different sinus. Posterior one opens into the superior meatus. This middle one and this anterior one opens into the anterior or this sinus which is coming to this middle meatus. So the middle meatus and the superior meatus, they are basically draining this particular ethmoidal sinus. The importance of this ethmoidal sinus is that this is lying deep to this midpoint or midline here. We have this orbit present in here, the wall of the orbit in the midline, we call them as medial wall of the orbit. So, this is a CT scan cross section that we are seeing here. So, this particular CT scan cross section, this is the orbit of the right side, this is the orbit of the left side. This is the nasal cavity and this here is lying ethmoidal air cells. Now, you can see how close this ethmoidal air cell is there on the medial side of this orbit. Now, on the medial side of the orbit, we have a nerve exiting. We call them as optic nerve. The optic nerve is wrapped around by a meninges there, which is a dura mater, which contains the blood vessels. Now, by any chance, if you have a ethmoidal air cell infections and you are not treating it properly, what can it happen? It can breach through thin the medial plate of the orbit and bring the infections to the orbit itself and affect this particular optic nerve and as well as the meninges. So, that can create the infection to the optic nerve, we call them as optic neuritis, and the infection can travel to the dura mater sheath to the deeper structure, can create meningitis, can create this particular problem or the encephalitis. So, this untreated ethmoidal air cell sinus has a close vicinity with this medial wall of the orbit is the deadly infections. Coming to the sphenoidal air sinus, which is deeply placed over there. So, this sphenoidal air sinus, the air sinus grows in the sphenoid and opens into sphenoidal recess. This is what we have learned about. This sphenoidal sinus is again deeply placed. On top of that, we have a pituitary gland which is seated in the sella turcica. So, this is having a close relationship with the pituitary gland itself. So, from here as well, it can send the infection to this particular brain region if it is not treated well. So, this particular sphenoidal air sinus also supplies or supplied by the V1 and this one also supply the V1 divisions of the trigeminal nerve. So, if we have infections to it, we have a pain or sensations around the eye or orbit or front region of the forehead region. Coming to the sinus, which is the largest of all, we call them as maxillary sinus, which is present in the bone or body of the bone, we call them as maxilla. We have two maxilla present, right side, left side. So, right maxillary sinus, this one black one you see and left one which you see. This midline is the nasal cavity and this is the nasal concus that you are seeing. This is the orbit. So, this is a slide section or MRI sections of the paranasal sinus exposing this particular sinus, we call them as maxillary sinus. Now, maxillary sinus itself is a short note with different boundaries. So, this particular sinus looks like a pyramid or triangle. It has an apex, this point is the apex which is direct to the bone, we call them as zygomatic bone. This one is the floor of it which is related to this particular maxilla floor, palate bone over there. Medial side, this is the lateral wall of the nasal cavity. Roof is formed by the orbit. So, this is the boundary of the maxillary sinus. Now, this particular maxillary sinus has an opening over here. So, this opening that you are seeing here, we call them as maxillary ostium. So, this maxillary sinus opens into this particular maxillary ostium into the middle meatus and the heart of that particular part we call them as hiatus semilunaris. So, this maxillary sinus, the boundary of it, how this particular boundary is there, where exactly they are located, this is the only sinus that we are born with, this is the largest of all sinus that we have. And most commonly, we see this particular sinus affected and infected in individuals. So, clinically, maxillary sinusitis is very common. So, coming to the blood supply and innervations. So, this maxillary sinus is supplied by or mucosa over this region supplied by the maxillary divisions of the trigeminal nerve. So, the pain of the maxillary sinus comes on the cheek region and the blood supply is also coming from the greater palatine sphenopalatine artery which is supplying this particular lateral side of the nose and the septal region of the nose. So, we have to know about this particular sinuses. This chart is a must read, must come prepared here. Different sinuses and drainage side. These are the exam questions for the Viva, these are the exams question for your OSPE, these are exam questions for the MCQs, these are exam questions for anything and everything that you go along with your courses. So, drainage of the sinus, name of them and what sinus opens into which side. Now, coming to the fractures related to the nose. If you have a blow or trauma to it, This is the commonest facial bone to fracture, nasal bone. So, nasal bone fracture is common, right and left nasal bone fracture is the commonest one which gets fractured to this particular region. If you have deep penetrating fracture, it can fracture along the maxilla and the frontal bone as well. And that particular frontal maxilla bone, if it is bridging this cribriform plate of ethmoid, we have a leakage of the CSF. We call them as CSF Rhinorrhea. So, where the CSF leaks in into the nasal cavity and drains out like a unrestricted flow of water. So, this fracture we call them as maxillary or facial-maxillary fracture, which is a deep fracture of the nose region. Coming to the clinical problem that we are referring here, this is commonly given in examination. We call them as epistaxis. That means bleeding coming out of the nose. This nose bleeding can come out through the opening, external opening or internal opening. We call them as internal epistaxis or external epistaxis, depending on through which opening they are coming. The reason of opening or reason of this epistaxis is that breach in the blood vessel which is commonly conglomerating in the little's area. What are the blood vessels conglomerating in here? We mentioned here. Now, this epistaxis is common in two age groups, young kids and elderly. The young kids, in case of this young kids, more common cause is ulceration of the nasal septum. Why? Because this particular region where this is accessible part of the nose, the kids have a habits of picking nose. So, accidentally through the nails they injure the mucosa and create an ulcer. That ulcer erodes this blood vessel and leads to hemorrhage. In case of the elderly, they have a chance of high blood pressure. If you have a high shooting blood pressure, that can rupture through and create this particular same thing, epistaxis. So, this particular epistaxis, if it is coming externally, we call them as external epistaxis. If it is coming through posterior nasal opening to the mouth and coming out, we call them as internal epistaxis. So, the cause of epistaxis is a bleeder from this phenolpalatine artery or greater palatine artery or these facial arteries or labial or septal branches. So, they can be tested as MCQs, branches, or they can give a clinical questions like 7-year kid coming with the epistaxis, found to have a bleeder coming from the anterior side, and on examination it is shown that the anterior part of the nasal septum which is having an ulcer or eroded, etc., etc. So, this is how the clinical question may be framed. So, you have to explain what do you mean by epistaxis, why this particular little area is common for epistaxis in the kids and the older ages, and what are the bleeder vessels that it is present in these regions, and the clinical related to this particular septum anatomy. Infections of the sinus, we call them as sinusitis. What do you mean by sinusitis? The mucosa which is lining the sinus can get infected. Just like the nasal mucosa present in this nose or nasal cavity, the sinus also covered with the same nasal mucosa. So, if you have an infection from the nose region reaching to the sinus, we call them as sinusitis. It can affect individual sinus like frontal sinusitis, it can affect individual sinus just like maxillary sinusitis, ethmoidal sinusitis likewise, or it can affect all of them or two of them or common group of them. We call them a sinusitis in group or individual sinusitis. So, for example, if you have a frontal sinusitis, patient complains pain over the forehead region. If you have a maxillary sinusitis, patient complains pain in this maxilla or cheek region. They ask you why this is paining in the forehead region in the frontal sinusitis, and in case of the maxillary sinusitis, they are paining in the cheek region, because the two innervations are different in the frontal region, and that we also mentioned about it. So, if you have this particular sinusitis or infections, they present with the pain, lethargy or any kind of discomfort in this facial region depending on how they are present. Deadliest of all is the infections of the ethmoid. They are very rare, not very commonly seen, but if they are affected, they can affect deep structure. What deep structure? Optic nerve, optic neuritis, they can affect this particular meninges, they can lead to blindness, shrinkage of the blood supply to this particular ophthalmic artery, cramping them, so that can lead to the damage to the retina, etc., etc. This is very deadly if it is not treated well. Commonest of them is maxillary sinusitis and a frontal one. So, this particular maxillary sinusitis affecting this particular sinus. Now, if you look at this particular cross section picture and given in here, you see that there the picture which is given in. So which maxillary sinus do you think in this picture is affected, right side or left side, and why? Which side? Left side. This is left side. This is affected. Why? Why this one is affected and why is it not? Because you hate left guys, that's why? You have to rationalize, right? This is not an art class or an economic class. My heart goes with the right side, that's why I am saying this is right side affected. You cannot, you have to put a logic to science people. So why you are saying this side is affected, infected, and this side is not? You have any good reason for it or no? If not, I am not going to tell you, because you are going to treat your patients. I am not going to treat your patients. You have to find it out. I gave you anatomy, I give a diseased maxillary sinusitis. You have to understand which one is diseased, which one is not. That's your job. That's not my job. Anyways, so maxillary sinusitis, this individual is suffering from a maxillary sinusitis. I am not going to tell it which side is, but you have to find it out. Coming to these infections of the ethmoid, to these particular olfactory nerves, that's what we have talked about. Olfactory nerves is starting with the mucosa in this roof of this nose region. So this nasal cavity, the roof region, we have the olfactory nerves. This mucosa present in here, we call them as olfactory mucosa. So these nerve endings which is coming over here, present in here, pierce this plate, we call them as cribriform plate of ethmoid. They pierce over here and assemble here, form the bulb of the olfactory nerve. So this is the bulb of the olfactory nerve in this base of the brain region, and then we have this tract, we call them as olfactory tract, and then we have the olfactory nerve goes to this particular brain region like this. So we have a picture like this. So this is the olfactory bulb, this is olfactory tract, and then olfactory nerve goes to the olfactory region. What they do? They carry this sensations, which is the smell sensation, from this particular roof region, piercing through this is the zoom part, this is the olfactory plate, through which the nerves are passing, they uniting in here, forming the bulb, then tract and the nerve, and they grade to this or reach to this part of the brain, we call them as olfactory region of the brain, and they carry the sensation or special sense there. So this is about this olfactory nerve, how they are going. Now, if you have a trouble in the olfactory mucosa, if you have this particular nerves are damaged, then this particular olfactory nerve is not carrying this smell sensation. Then we call them as anosmia. So this particular anosmia is tested through sniff test. In physiology, they might be testing this olfactory nerve. So we call them as sniff test. Either you close one nose, give a familiar smell to that individual and smell it, yes or no, that one, or then do it on the other nose so that we can test this particular olfactory nerve individually, right side and left side accordingly. So we call this olfactory nerve testing, right side and left side. So this is all about this particular nose nasal mucosa related to it. Now coming to the surgical part which is related to it. Now if you have a tumor in this pituitary gland, now this pituitary gland present deep inside the brain related to the base of the brain. So we cannot cut the skull, remove this particular brain cerebrum, go deep and do the surgery. So for this particular tumor in the pituitary gland, we call them as craniopharyngioma, we have a bypass channel. We call them as transsphenoidal surgery. So what do they do? We go through the nose, we go to the nasal cavity, go to this particular bone. We have a bone over here, we call them as Vomer. We break this Vomer bone, and once we break this Vomer bone, reach to this particular sphenoidal air sinus. We break this sphenoid bone, sphenoidal air sinus, reach to this particular sella turcica. Once you reach to the sella turcica, then you grab this particular growth of here in the pituitary gland and do a surgery. This is endoscopic surgery, highly skilled surgery that we do. By breaking the Vomer bone, passing through the nasal cavity, do a surgery related to the nasal cavity. So this surgery we call them as transsphenoidal surgery of the pituitary gland. So this is all about this particular nose paranasal sinus, which is related and important for us to clinically judge it. An exam question may come clinically or gross question may come to narrate these different parts of the nose paranasal sinus.